I thought this is really crazy. I mean, this is voodoo. One of those old senior surgeons said, this guy does not need shockwave. He needs to travel to Lourdes and pray. One of 50 patients lined up for shockwave therapy. And then I called the device. I tried to learn, to understand how the device would function. Out of those 50 patients, 26 healed. At the end of this year, I saw that all patients where the device broke healed, where I didn't deliver the number of shocks that I wanted. The seed that received shockwave are 30% quicker. You just reset the system to a way where it starts to do what it is able to do. This will be in the guidelines of all surgical fields to say you have to apply shockwave after or before wound closure.
Yes.
And health insurance will say, you have a complication, you didn't use shockwave.
It is a privilege to have Dr. Wolfgang Schaden today with me, from my perspective and how much I know him and the shockwave community. He is the godfather of shockwave therapy. So thank you very much for finding the time to be with me here. For somebody that is just listening for the first time, if you can tell us a little bit about your professional experience, like when did you start in medicine? What is your professional background?
Yeah, so first, thank you for the invitation. It's my pleasure to share my experience with you and your auditors. From the very beginning, I wanted to become a medical doctor, the first one in our family, so I had no family connections. And very early in my studies, I just recognized that for me, it's very difficult to handle really sick people, cancer people, and so it was quite clear in the early stages, after 1.5 years, that I want to become traumatologist. In Central Europe, in Austria in special, but also in Switzerland and other countries, traumatology is a specialty. It's not orthopedics and traumatology, it's traumatology. And you are dealing with the complete trauma patient. So you do brain, spinal cord, thorax, abdomen, and so on. So it's really a huge field. And I really liked it when I started my professional life. I also was emergency doctor on the helicopter for 10 years, twice a month. And I really liked being a trauma surgeon. Then later on specialized in knee arthroscopy. It was when I started working, arthroscopy was not yet invented. There was no ultrasound, there was no CT, there was no MRI. So we really touched the abdomen to know if we will open the abdomen or not, because the patient is bleeding. So it's quite old meanwhile. So this was my beginning. And so around mid-90s, I started more and more to be interested also in microsurgery, and I became part of the replantation team in the trauma center Meidling, which is one of the busiest trauma centers in Europe, in Vienna, center of Europe. We are dealing with around 65,000 trauma patients a year, and just trauma. All the specialties are coming in to help when you need a heart surgeon, a thoracic surgeon, but the patient is managed by the trauma surgeon. This was the case when I was young, and this was very fascinating. So in the late 80s, when the first time he distributed different medical devices, and also the first shockwave device. And he was very, let's say, he really called my boss twice a week and really wanted that he is trying the shockwave device. And once when I was with Heinz Kuderner, who was my boss in those days, he called again. And the secretary said, what should I do with him? And he said, Wolfgang, just take it and it's yours. Take care of this guy. And so I took the call and I said, yeah, what device do you have? And he started to speak about shockwave. And I thought, this is really crazy. I mean, this is voodoo. What do they? So I said, okay. And what are the indications? He said, this is for non-healing fractures and so on. So I said, okay, I will perform a trial with non-healing fractures and then we can discuss. He said, okay, I'll bring you the device tomorrow. I said, no, when we perform a trial, it's earliest in 6 months that we can start because I have to prepare it and so on. And this was the real reason how I fell into shock.
Huh.
Yeah. And then I called all the surrounding trauma centers and hospitals asking for non-healing fractures. And you can imagine when you have patients with pseudarthrosis with non-unions, you are very happy when there is a trial because these are always patients that is very difficult. You did already 3-4 surgical procedures. And so within a couple of months, I had 50 patients lined up for shockwave therapy. And then I called the device. I tried to learn, to understand how the device would function. And of course, in those days, when there were 3 publications out dealing with non-unions, and these were the days where I knew every publication concerning shockwaves, not urological.
Yes.
Meanwhile, it's impossible.
Yes. I wanna ask you when was the year? Like, do you remember what year was it that
this was
you first used?
This was 95.
95. Okay.
1995, yeah.
Okay, so take me to that moment when you took this device from somebody that presented to you, and then you directed that to the bone, to the non-union fracture. What was that moment? What was your expectation, or what were you?
No, I called in the physicist that was from this company. It was HMT. Company doesn't exist anymore. High Medical Technologies, a Swiss company. And Rainer Schultes, by the way, I just had a phone call with him. He was a young physicist, and he explained to me what kind of pressures we are delivering into the tissue. And I was quite frightened because, I mean, this is really high energy. I mean, 12, 15 bars, that's the pressure that you have 12 kilometers below sea level. So this is really within nanoseconds.
Yes.
And the only reason why I used it was because there were already more than 10 years of experience in kidney lithotripsy. It did not report on major side effects. So I said, okay, this technology seems at least to be safe. And of course, my idea was that we will do microfracture without, like the stone. This was the only model we had. So I thought, you don't do any harm to the soft tissue surrounding the bone. And in the bone, you will create some microfractures. And this was the reason for I said, okay, what is the highest energy level? How many pulses do you use for shoulders? Because there were already some, and they said for shoulder pathologies, 1,500, 2,000. So I said, okay, I will use 12,000 because we are dealing with bone. And this was really the beginning. And I used 12,000 shots, which was an hour of treatment. It was noisy. We had the ear protections and really, and nobody liked it. Also the anesthesiologist, because it was boring. You were staying there for an hour, very noisy. And and I had really, really bad cases. And there was a nice story because my pictures, my x-ray pictures, all the surgeons meet in the morning to see the surgical program of the day. And when I showed, this is a patient of mine, will get shockwave therapy, one of those old senior surgeons said, this guy does not need shockwave. He needs to travel to Lourdes and pray. This is the only way he can get out of that, which could show that this was really a very bad selection. I had really the worst of the worst. And okay, we treated them and then we tried to put the plaster cast or immobilization and just waited. And at the end of the day, out of those 50 patients, 26 healed. And this was not to be expected. So I was really astonished because I did this whole study to show that this is voodoo and won't work. And 50% is not a lot, but it was, for me, it was convincing because I knew the patients. And this was really a bad selection of patients. And this was the reason that I stayed with the technology because I wanted to understand what's going on. And the most magic thing in the beginning was, when you use whatever device at the highest energy level, really always like a car, you always drive it full speed, then it breaks. And this was what happened to our shockwave device. Yeah, we always used it with 28 kV. This was the highest,
Yes.
28,000 volts. Yeah. And so during the first year, 6 times the high voltage cable broke during the treatment, of course. And so this was in anesthesia, and we had just to stop the treatment because we wanted to deliver 12,000 shocks, and after 4,000, the device broke. The next patient was 5,000, then it was 3,000, and so on. And the fascinating part was when I collected all data. I still have all this data up to today because meanwhile, we are close to 6,000 patients in the trauma center. Just non-union fractures. Wow. And at the end of this year, I saw that all patients where the device broke healed, where I didn't deliver the number of shocks that I wanted. And so this was the first time that we doubted our model that we are breaking something. And then there was Markus Meyer in Munich who did those reactionship trials on rat femora. And he would learn that on energy levels where he couldn't see any damage to the bone, he had the highest osteogenetic effect. And so suddenly we said there is something wrong with our idea of destruction, microfracturing. Yeah. And then in 1997, we founded the ESMST, the European Society for Musculoskeletal Shockwave Treatment. This was the very first. Yes. And then already 2 years later, we changed it to international because there was also overseas Latin America interest, and we changed it to International Society for Medical Shockwave Treatment. Yeah. And this year we changed again. It's now because we learned that we are regenerative medicine in the best of regeneration. I mean, we use the body owns regeneration capacity. Yes. Which is a very elegant way. But it took us close to 30 years to understand how it works and how we can influence pathology.
Yeah, I want to ask you another question here because it's very important to understand the foundation and the history and how much you have contributed and you have done for the shockwave world. So how did you deal with, skeptics? Because first you were the skeptic. Then shockwave changed your mind, changed your patient's life. But then you had to go and now spread that knowledge and you had to educate others. So what was that process for you and what kept you going? Why you never quit?
First, there was a real boom in the late 90s and early 2000s in Germany, Austria, Switzerland. Everybody used shockwave and people did 20 treatments on a shoulder patient because very few, practically no side effects. So to misuse a technology, shockwave is one of the best technologies that you can misuse. It's very effective, almost free of complication. You can earn a lot of money. So I gave a lecture once about technologies that can be misused, and shockwave is the leader, the best. And this is what happened. And suddenly the health insurances that in the beginning tried to cover parts of the cost said, stop. Now we don't pay, we need evidence. And you won't believe it. There was 200 participants at the Congress, and after this decision, there was a handful of people that stayed, like Ludger Gerdesmeyer, Rompe, me, Vinzenz Auersberg, all the ones that started publishing, because we said we know it works. We have now to prove it. And this also is a connection between the people that stayed. We call our society Shockwave Family. It's not only a scientific society, it's a community because it is very rare in the scientific world that people share their knowledge from the basic research on. Yeah. Usually you try to keep it for your institution, for your university. Yes. And we really started from the beginning on to share and to also distribute. In my lab, I can do more of that. In your lab, we do that. And we publish together. And this stayed till now. I'm a little bit afraid that this will not continue because now it's successful. Now there is a lot of money also into this development. And this is always dangerous, that this basic collaboration gets more and more difficult. But for the moment, I'm still happy. And this was really helpful. And when you start like me having this mechanical model, and this was my message to the world for 8-10 years, and then I changed completely because our knowledge changed, because we learned that we are doing completely different things to the tissue. Stimulate, due to this mechanical impact, we turn on genes and groups of genes that start doing what genes are able to do, produce proteins. And these proteins, growth factors, they are attracting body-owned stem cells, and we can really see regeneration when using Shockwave. And so when I give lectures now, like overview lectures, I tell people, look, 20 years ago, I gave lectures and it was completely wrong what I told people. Maybe what I'm telling you today, in 10 years, I have a complete, if I'm still alive, a complete different. But this is research. This is when you change your knowledge, when you get more experience, you have to change also the picture of the world. And for me, one of the most important things that I learned with Shockwave is my patients do not care at all what is working in my brain. If I think I make microfractures and their non-unions heal, they are as happy as I think these are stem cells that are, you know what I mean? So the most important is being efficient, helping your patients, having very few or none adverse events, and the scientific community is a complete different. It's important. You have to convince people, but in reality, it is more important what you're doing for your patient.
Exactly, to produce results. I wanted just to go back a little bit when you talked about, ISMST, how it is truly for practitioners to learn and share knowledge. I remember first time I came in 2013 in Salzburg, when you presented somebody from ISMST, the age of participants. I remember I was the youngest one. I turned 20. I was 26. I turned 27th at Shockwave at ISMST family. And just now in Madrid, I turned 40. So it's truly a family, truly people, practitioners that care about patients' health and the success. And then it's very interesting. I heard this, that when people get compliments or when people help somebody, it triggers the same brain part as when you make money. And I think all the Shockwave users, especially the pioneers, have been pushed forward from the excitement, from the feedback of patients and clients. And
this is true. And I learned a lot of important messages with this technology. One is, when you see an unexpected success in whatever you do, or an unexpected failure, then stay with it. These are the interesting cases. Try to understand what happened. If you have your results, as if you do a heel spur, you know that about 90% of your patients will be happy. It's not a big deal, and you know the parameters that you use for your device. But I heard, it's a couple of years ago, a guy from Latin America who only looked at the 10 patients that did not succeed and tried to analyze them. And this was really fascinating, because he could, for practically all of them, he found a reason. One was a fatigue fracture of the calcaneal, entrapment of the nerve, infection, blah, blah, blah. But this is the real. And then you say, by excluding the right patients or but treating them differently, you can increase your success rate to 100%, because you just know whom you can help and which patient would not react or profit from your therapy. And that's the reason for we started education. Because when we learned that most of the failures using Shockwave is wrong education, wrong indication, wrong follow-up treatment, because there's a different pathology behind. And we could see, and this is especially in Germany and Austria, where we do 6 days of education. We have kind of Fachkunde. And in the beginning, the shockwave users, they thought, okay, they are crazy. They just want to make money for the society, and started the courses. And at the end, we asked, for who does this influence the everyday life? And we had almost 100% of feedback where people said, this really changes my perception. Because at the beginning, when I asked, who is using shockwave? All hands raised up. Who is using shockwave more than 5 years? All hands. Who more than 10 years? So, and they said, and what should I learn? And then they got the latest, the most recent research. And suddenly they said, wow, this is completely, I did not know that shockwave are able to do so. And when we started, we had 4 indications, the classic ones: non-union, ossifying tendonitis of the shoulder, his elbow, and the fasciitis. These were our 4 indications. And meanwhile, it's over 100. This is
and now it's moving, and you have been, I did a little bit of research, you have been part of over 400 studies in shockwave, and not just in bone healing. So for somebody, just to give them the perspective, nowadays, like the Johannes, right, from Innsbruck, he's doing now shockwave during open heart surgery. There's shockwave in spinal cord injuries. There's like shockwave that it's being used for ED, erectile dysfunction. There's for now the TPS for brain. So it's not anymore the shockwave just for bone healing, and then in dentistry for teeth. So did you ever expect it that it's gonna go there? When you look back now, like, what do you feel like, and where it's going next?
In the beginning, when we started to understand that we are turning on a very basic, crucial part of the biological pathways, we are stimulating the innate immune system. You know what I mean? So this is a very profound therapy, and can look to understand this easily also for lay people. When Jin Cheng Wang from Taiwan in Kaohsiung, he was one of the pioneers and is a good friend, and really we shared a lot of our research and understanding. He was the very first guy that proved that when you apply shockwave to tissue, especially to ischemic tissue, you create new blood vessels and you have better metabolism in the area. There is practically 90% of the pathologies we know are connected to poor blood supply. Correct. From heart, from lung, from brain, from legs, from muscle, from whatever. So when you have a key to increase the local blood supply and circulation, have more oxygen, more energy in the area, when you have this deep understanding, and meanwhile, there is more than 3,000 basic research publications proving this effect. And it's healthy blood vessels. It's not the pathological ones that hurt, like you have the red swelling and pain. No, it's the blood vessels we need. And at the moment where I got this understanding, and this is also accompanied by production of growth factors. And over the years, we learned we don't have a stereotype reaction of the tissue. It depends of the pathology of the tissue, how the reaction is. So an ischemic cell, endothelial cell, reacts much stronger to shockwave than a healthy one. So, it's just an incredible effect that at the moment where this understanding grew, for me, it was clear that this is a basic technology that will spread over. You know what we did? We treated seeds of kidney bean in a water bath, and then we planted them in normally, and we could see already after 3 weeks there is a significant difference in growth. The kidney, the seed that received shockwave are 30% quicker. So we are speaking about an impulse that seems to be biological, but really in a very deep sense. And by understanding that, it was clear that I tried to contact heart surgeons, I tried to contact neurologists. I said, look, have a look on that. Of course, you think this is voodoo, but try. You won't harm in the beginning your rats or your rabbits. And those that get infected by the idea, that's the ones that started publishing and pushing the development. And now, I mean, now we have the very first researches going into cancer.
Yes.
Because, sorry?
It's all good.
No problem. Because we consider shockwave as a contraindication till now. We consider shockwave as a contraindication when the tumor is in the focal area, because we are stimulating growth. So this doesn't make sense for tumors, it seems. But by learning more and more that we are also influencing the immune system, and what we know is when we have a small amount of cells, tumor cells, that we are injected in a rat subcutaneously to create the tumor. So if this is a small amount, usually the animals are able to fight the tumor. Only if the amount is too big, the tumor can spread. So the immune system just does not recognize the bad ones. Yeah. And this seemed more and more, this seems to be the perception of cancer, because before, in the last century, the whole philosophy in medicine was to kill tumor cells with the knife, with the gamma knife, with toxic. And I call this is the Hollywood phase of cancer beating. Kill the bad and everybody will be happy. This did not really work, because it was not possible. Because the problem was a lot deeper. And it might be that shock waves are able to stimulate the immune system to demask the tumor cells so that the body-own immune system is able again to recognize them and to fight them as they are able to.
Yes.
There are my sons that are very technical and not at all medical educated. When I explained to them my picture of shockwave, they said, is it a little bit like the reset bottom of your computer? You just reset the system to a way where it starts to do what it is able to do. Wound healing. We have chronic wound. We know the body knows how to heal a wound. And then you apply shockwave and you reset the system, and then it starts to work.
Yes. Yeah. And see, I've been doing shockwaves now for over close to 16 years. I'm in private practice and I've done over 50,000 treatments so far using different type of shockwaves. And what we are doing as a clinic now, yes, we do it when people are in pain and we're treating a pathology, a condition, mainly musculoskeletal, some mensal erectile dysfunction. But now I've started, even on myself, I do it more for prevention, more for enhancing the healthy tissues, maintaining the body, because if we can prevent something, it's much better than going and fixing it later. So what is your comment with all your knowledge on shockwave? Like, can it be used for prevention? Can it be used, for athletes, to enhance athletes? And it's almost like a natural doping in a way.
There is a lot of, meanwhile, knowledge and also publication showing in this direction. The very first one doing so was Rainer Mittermeier. We have a standardized model where we form a flap on the belly skin of a rat. And we ligate one of the nourishing blood vessels. So this flap, which gets no therapy, 25% of the flap become necrotic. And in the very beginning, this was to show the forming of blood vessels. We formed this flap, resutured it, applied shockwave, and could show that the shockwave animals have significant less necrotic tissue compared to the control group. And Rainer Mittermeier made the same trial. In one group, he applied shockwave 24 hours before the surgical procedure, immediately after, as usual, and 24 hours later. And what we could show in this trial is that all three shockwave groups are significant better than the control, but there is no significant difference within the groups, which means it makes no difference when I use shockwave preventively before the danger comes. And this is what we also could see in our cell culture. When you apply shockwave to a cell culture, you activate all the energies in the cell, and suddenly the cell culture starts to proliferate. And this is exactly what we are needing when danger is coming from outside. And danger can be a trauma, but danger is also when you do a marathon. Yeah, because this is really, this is ischemia and so on. In my personal private office, I have a lot of patients coming for shockwave therapy a couple of days before competition. Because this, I have the world champion 100-kilometer runner. Of course, they are all crazy. Wow. Nobody does this usually. But he said all of us have achelodynia, which is to be expected. I mean, if you run 100 kilometers, this is over 50 years old. And he said, when I get shockwave up front, pain starts after 80, 90 kilometers. This gives my advantage. Proof of concept we did. This is 10 years ago. One group of patients has a lot of complications. To expect complications in wound healing is the bypass patients, because they are all have circulation troubles. That's the reason for the kit bypass. And especially the donor side on the legs have a complication rate, wound healing disorders between 25 and 30%. And we took these patients and took, I think, 50, 25 received shockwave immediately after wound closure, and the others placebo. And we could show significant better wound healing. A sepsis score all 5 days better, less needs for antibiotics, less analgesics, less surgical revisions. So my picture of shockwaves in the future is all surgical fields that are dealing with patients at risk. And I mean, we have more and more elderly people, especially in traumatology and orthopedics. We have diabetics, we have obesity, we have smokers, we have we have patients that need corticosteroids due to lung problems. So we have a high group which is exposed to a higher healing risk. And I can imagine, I don't know if I'm still alive, but that this will be in the guidelines of all surgical fields to say you have to apply shockwave after or before wound closure.
Yes.
And health insurance will say, you have a complication, you didn't use shockwave. Sorry, we don't pay for it, because you know what I mean. It's like hypocoagulation. If you don't do hypocoagulation and the patient has a thrombosis, it's a state of the art problem. And this is my vision of shockwaves in the future.
Amazing. Hearing this, you're melting my heart, because every single day I deal with, like, even people that I know. I had my son's teacher. I knew he was going for hip replacement. And I said, please, once you get it done, I want to see you to help you with recovery. He asked the surgeon says no shockwave. What happens? He starts compensating, and then few weeks later, he has a stress fracture from the compensation on the ankle. So it causes another side effect. And so the biggest challenge it's been educating healthcare practitioners on the shockwave, how important it is, especially surgeons, because surgery, it's another injury to the tissues. You're fixing what you need to fix, but now you have to also heal what has been, cut and damaged from the surgery itself.
In one of my presentations, I have a picture of a fracture of a tibia, and I show how this was treated 2,000 years ago. You try to put back the geography, the anatomical position, it's straight, and then you have a piece of wood that you put on it. And then I have a slide where you see the same fracture and you see the intramedullary nail. And I say there is no difference in 2,000 years of development, because the one who puts the piece of wood or who puts the intramedullary nail is dealing with mechanics. Nothing is influence healing. And in the 21st century, we should take care on the soft tissue surrounding our problem. We are responsible for healing. We are not responsible for, because what I say is, when they put the piece of wood on the leg or they do the last suture, then the surgeon and the patient have to start to pray that it heals, because we just put it in the right direction. We did not do anything for healing. And this has to, but this is a complete changing of concept. and it will take another generation of medical practice. And for me, I really was 100% surgeon. For me, all other disciplines was just not to be expected, because when you are dealing in the helicopter with patients that need intubation, that have pneumothorax, you have to act immediately that they survive. But at the end of my life, I started to understand that this is necessary, but healing is the main issue, and the surgeon is not out of responsibility leaving the OR. He's out of the responsibility when his patient is back to work, back to sport, back to enjoying his retirement. Then but this is not yet in our mentality.
Yeah. But thank God that there are people, like you and like the Shockwave community that are pushing this and focusing in the science, and we understand more what is needed for healing, because I was dealing just with like some construction guys, that fix cabinets and stuff. And I said, hey, you create the kitchen, you install it, you do that. But if you install it bad, you did one-time job. I'm going to see that rest of my life that I live in that place, and the same goes, from the soft tissue rehab and all that. So I want to pick your brain a little bit more to other regenerative medicines, like stem cell therapy, PRP, exosome. So from your perspective, and I know this person, but I wanna hear your perspective, where does Shockwave fit?
It's a difficult question because we do not yet have enough data. We changed now during the managing board meeting in Madrid a week ago the name of the society, International Society for Shockwave and Regenerative Therapies.
Therapies.
And we added a part of our indications. We have standard indications, recommended, and so on, and now combined indications, where we say team player are better than single player. So there is a lot of first experience that shows that when you combine shockwave with pulsed electromagnetic fields, with light, with PRP, with stem cells, for instance, we especially in stem cells, this was very interesting for me, because when you when you are cultivating stem cells, we call the generation passage. So one passage is the first generation, second, third. So after 6 to 8, they lose their property to differentiate in different tissues. When you apply shockwave, they stay up to almost 20 generations and keep their property. So meanwhile, we have people that apply shockwave to the fat tissue before they do suction and transplantation. So the combination of this therapy with other tissue engineering, with other regenerative therapies, is for sure in the future a big window, and we are now trying to develop that. On the other hand, I always have because I'm old, a certain bad feeling when I combine a complete uninvasive therapy with an invasive step. Because, the very first time we could prove the influence of stem cells was, I think it's 10 years ago, 12 years ago. There was a group in Germany around Dimmler, Eichler published it. They created in a rabbit model, they created an ischemic muscle by ligating an artery in the gluteal muscle of the animal. And then they waited a couple of weeks to have really chronic ischemia, like we know it from the heart in muscle tissue. And then they applied shockwave to this area, and 24 hours later, intravenously, they applied stem cells, endothelial stem cells. And they could prove that there is a significant increase of endothelial stem cell in the preconditioned area of the gluteal muscle in the treated animals compared to the placebo ones. And they published it and started to use endothelial stem cells and shockwave therapy on the heart. And I had Johannes was still young, the heart surgeon, and we discussed this paper till 3 o'clock in the morning at the bar, couple of beers. And then we suddenly said, why did this animal know that next day they will get stem cells from the lab. So if there is a signaling to get stem cells, it's not to the lab, it's to the body.
Yes,
And this was 2008. 2008, because we ran out of money. We didn't have, this was the big crisis, and we had no sponsorship. And so I called Jing Wang in Taiwan, because he already had a big lab, and said, can we reproduce this trial that is just published, but without giving stem cells? And he said, yes, we can, but you have to send me somebody who is doing the job. I don't have enough people. And so I asked Johannes, and one of his students, Chan, said, I like to go for half a year to Taiwan. I like Chinese food. And we said, okay, you go there. And he reproduced this trial, and we had the same results without giving stem cells. And we published it. And this was then when we understood, yes, we are attracting body-owned stem cells by applying shockwave to ischemic tissue. And this was the breakthrough. But it was really adventure. And then we published, of course, together with Wang. It's a very important step to stem cell research. So for me, I don't really need the lab for the stem cells, but it might increase the effect.
Yes, yeah.
I agreed to change the name of the society. We are working now in this direction. And my vision is to combine it with regenerative therapies that are non-invasive as well. I think this would be the dream.
Exactly. Because one analogy that I explain to clients when they ask, especially for stem cells. So I say shockwave is the regeneration seed. Anything else kind of becomes the fertilizer. But in my mind, it's like, why do we need to helicopter cells to take the cells from one body part to move them to the other? When with shockwave, you trigger nervous system respond, you trigger the healing respond, and then you let the body bring all the cells that it needs to repair itself. And you do that completely non-invasively.
This is a little bit, I mean, I had this impression also. We started once a big study, the Combat Wound Initiative, where we wanted to see how shockwave is influencing wound healing. And we tried in the beginning to apply shockwave to burn wounds and taking biopsies every hour and then every 24 hours and so on. And we were all fascinated, and the lab, and what kind of proteins are we testing? And so at the end, I was quite frustrated because I very much like a good bouillabaisse, this French fish soup. And there are chiefs doing this soup in a way it takes half a day. And I imagined, I can take a picture when the chief prepared everything he needs for the soup. And then I do a picture half an hour later. And after 1 hour, and after 2 hours, and after 3 hours, and then I think I'm able to redo this procedure. As we know how nature is working, we have an upregulation followed by downregulation.
Exactly.
If we measure something at a certain time point, in reality, it seems that these proteins are involved in the procedure. But when we think we produce this protein in the factory and then we put it, I think this is very naive and it's very expensive. It makes a lot of people very rich. But in reality, in my eyes, this is not the way we should approach healing. Healing is so sensitive. Healing is so influenced. There are so many factors. Brain is involved in a very strong way. This is the reason for FDA wants to exclude brain in trials. Of course, when I treat a patient with a chronic ulcer, I show him pictures of patients that have very similar chronic ulcers that healed completely. I want that this patient sees that and say, wow, so I have a chance. I never believed that such an ulcer can heal. I have it for 5 years and you show me it. Look, this was a patient was older than you and obese, and you are not, so we can't, because I think this part is extremely important to be mobilized with shockwave. Some of my sons said, this is a placebo machine, because what you are doing is you stimulate the body to do the body own healing processes. And we have a lot of approaches, and shockwave is really one of the most potential. But also our speech, our feeling, our empathy is all connected to healing. And I think this understanding is important, and this is what we try to communicate also during our courses, that people really, you adapt the patient to the shockwave. You show him, you do it on yourself, so he loses will hurt. And I heard that is so dangerous, but this is the way we can really handle that. I think there's still a question possible.
Yes, yeah. We'll try to close it pretty soon. But I have just a few more short questions. But one thing that I need your help, or we need your help for patients and for practitioners as well, is that now shockwave, it's because there's no side effect. It is the modality that can be easily misused. And a lot of patients end up, with practitioners that don't have the knowledge to treat, or they just go and do it. Like, what do you say to a practitioner that it's looking into a shockwave?
I think it's a waste. Let's say it's a waste. If you get, I give you a tool which is able to regenerate your heart muscle, and you use it to treat your wrinkles, which is okay. I have no problem because it works. I mean, I lost a whole box of champagne because I said it won't work for cellulite, because cellulite in my eyes is not a pathology. Cellulite is a pathology in the eye of the observer, but not on the fat distribution on your body. But shockwave has also a certain regenerative potential. I don't want to say regeneration, but we change the collagen structure and we can really influence it. And meanwhile, we have good data for that. But for me, it would be a shame if this therapy is not developed for more brain problems, for peripheral nerve problems, for spinal cord, for heart muscle, for diabetes. We have the very first hints when you treat the pancreas that new insular cells are forming. Cancer. These are the problems we have in health on this planet. We have more elderly people. We have diabetes. This is what really is also the ones that produces the highest costs. And this is where we need such an easy, complication-free therapy. And if it's misused for athletes to get better time, I don't know, for 100 meters races and so on, I don't care. But this is not the mission. This is something like, we can land on the moon, and now I have a pen that writes also when this is what that's fine. This is how economy and how human brains are functioning. But we should not lose the track where we really need this technology, and it should not be destroyed by those who use it for playing around.
Great. So is there any question that I should have asked you and I didn't?
I don't think so. I mean, just because because at the beginning we spoke about the society and the importance that the society has. This was also, Richard Thiele was one of the great pioneers of shockwave therapy. And he was the one who was the leader in Germany. And as very often in medicine with new technologies, it was a fight between companies. So when there was a society, it was a Douanier Society, MT Society, Dort Society, whatever, it was companies behind. And he really suffered from them because he said, this is not scientific, this is not the way. Germany was the most active country in Europe concerning shockwave. And I was one of the few Austrians interested in it. And we got friends, Richie and me. And for 3 years, he said, we need an international society. And you have to found it because you are Austrian. So the Germans don't get jealous, because when I found it in Germany, I would have all and I said, I hate societies. You have a president, I hate bureaucracy. And he said, no, but we need it. If not, this will never develop. And after 3 years, in 97, I said, okay. And we invited people where we heard that they already had one paper or published on shockwave. So there was one from UK, it was a couple of Italy, some of Germany, one of Turkey. So, and this was the foundation meeting of the ESMSD in Vienna, and then this was the beginning of this scientific background. Already in 97, showed it now in Madrid, we had the very first guidelines that we published on the four very first indications. Meanwhile, as I said before, it's over 100, and a lot of things changed over this last 30 years.
Wow. Okay, Dr. Wolfgang, I don't want to take more of your time. I would love, probably in the future or later on in a year or so, to do another interview where we can probably hit different topics and cover more. I know you're very busy, even though you're retired from treating, at the hospital, but now you're doing more for the world because of you and because of the society. People in Canada, people I'm currently in Kosovo back home, their life is changing around the world because of the shockwave and all your work. So you have been the first domino. And I remember I met Richard Thiele, myself. I remember the conversations. So you guys are the domino that has started this effect, and just God knows where it will end and stop.
Yeah, thank you, Uran. It was my pleasure. And
yes,
I hope that we have in the future the opportunity to share new knowledge, new experience, because this is really a development where, meanwhile, we have more than 2-3 publications a day. And I have to say, I don't know all of them, as in the beginning.
True. Very true. Okay, thank